Russia and the European Union are offering India equipment to generate oxygen as its COVID-19 crisis worsens. Nearly 24 oxygen-generating machines from Germany are expected in New Delhi in the coming days. India recorded the world's highest number of new infections on Saturday, more than 346,000. Its healthcare system is nearing collapse, with hospitals short of beds, medicine and oxygen. Doctors say they're turning away patients every day.
I came here to get my grandfather treated. He's suffering from COVID-19. They are not letting us in. We don't understand anything. The security guard is saying there is no doctor available here. If there is no doctor near the emergency ward, then where will we go? His oxygen level is dropping alarmingly.
If the government wants, they can do anything. They have the power and they are using it also. The problem is that they are not doing it properly. I go from hospital to hospital. I have been pleading with everyone, every person I meet.
Well, let's now bring in Dr. Upendra Kaul, who's a cardiologist at Batra Hospital. He's joining us via Skype from New Delhi. Dr. Kaul, thank you very much for being with us. I've been told the situation in your hospital is a very dire one. Tell us about the current situation. Your oxygen supplies, I understand, are very low. When do you expect to get new supplies?
Well, you're absolutely right. The situation in Batra Hospital is like any other big hospital in the city of Delhi, very precarious. We were using about 8,000 liters of oxygen per day during the COVID period. But then, unfortunately, in the last few days, it has been reduced to about 2,000 or 1,500 liters per day is coming in, with the result that, patients are in great trouble. We are planning to discharge them. We are telling them to find a different hospital if they can. They can, we're giving them written instructions that we are short of this supply. And when we try to ring up the supplier who has been supplying oxygen quite well for the last 30 years consecutively, they have put off their telephone calls. We can't email them.
Yeah.
Obviously,
who are the suppliers?
They don't have any oxygen.
I'm sorry to interrupt you, Doctor. Who are the suppliers? Who is in charge of delivering these oxygen supplies, and why haven't they done it?
This is a company called Eon, which has been supplying for the last 30 years, and there are designated people in the critical care medicine and anesthesia department in our hospital who have been handling them. But they say that they are totally helpless. And what happens is because this oxygen comes in, vehicles from the neighboring states, because Delhi itself does not have manufacturing facilities. So what is happening on the borders also, they are, not allowed to cross because everybody is scarce of oxygen, and they try to, hoodwink the drivers, take them in different directions. People are hoarding oxygen cylinders at home. People who don't need oxygen, they don't know tomorrow they may require, so they're keeping 2-3 cylinders with them. So this is a very unfortunate situation we're facing.
It's a very dire and critical situation, not just for your hospital, but for several hospitals in India, in New Delhi. You talked about the fact that oxygen suppliers are saying that they're helpless. Who then do you turn to as a doctor? Who do hospitals turn to? Who is to blame? Is it the government? Is it the health officials? Who is to blame for this, what seems to be a lack of forecasting?
See, our administration goes to the government, the Delhi government, the central government. They all say that we're going to instruct the company. They have to supply at least 3/4 of the oxygen, but the company doesn't pick up the phone. They just don't have it. I think the planning and during the last few days or last week, it was very clear that the number of cases is increasing. Number of cases increasing, as you already gave the figures. That means that a large number of them are going to require oxygen, not necessarily ventilation, but high pressure oxygen, or maybe even 2 to 3 liters of oxygen if their saturation goes below 90. Well, that's not available. So what do you do? So, it is very, very sad that, people are coming to the hospitals in a very hostile mood. Their families are coming, armed with bricks and other things, saying that, you have been treating us for so many years. What happened to you now? Doctors in the hospital, many of them have got COVID infections. They're out of the hospital.
And imagine this is a very difficult
pathetic
situation for you as a doctor to deal with, you know, when patients are coming in and asking for your help and you're not able to deliver it. India, as we've seen, is setting another record today of COVID-19 infections. The government has been blamed for relaxing restrictions too quickly. What would you say right now? What is your message? And what would you recommend to the government as a doctor to deal with the situation right now in an urgent way?
I think the total priority right now should be healthcare. Let us forget about elections. Let us forget about rallies. Let us forget about who is going to win which state, because that has been going on for the last couple of weeks, maybe a month. We need to concentrate our energy how to get people oxygen, how to use, special ways in which you can, make oxygen supplies with trains on, special tracks, which are, absolutely not interrupted on the way, and escorted by police, because you have to escort them with forces because of the demand. When there is so much of demand and supply is low, people tend to stop them and ask them, give it to us.
Right.
So I think it has to be a severe multi-pronged attack on how to get oxygen, and whatever oxygen facilities of manufacturing or making it is there, you have to augment it as far as possible. You just told that Germany is sending, Europe is sending, Dubai is sending. That's very good, that's welcome, but we need to expedite things so that every day we're losing people. And the number of people dying, I think we are underreporting them. That's not going to help us.
Thank you so much, Dr. Upendra Kaul, for taking the time to speak to us and telling us about the situation at your hospital and across India. Thank you for joining us on the News Hour.
Thank you.
Now, U.S. regulators are